Hi, my name is Batali.
Hey, I'm Connor.
I'm Brenna.
Hey, my name's Hitan.
And I'm Ashley Nguyen, and today our groups will be presenting about DentaPen. DentaPen is advertised as a cordless, wireless syringe system for painless and efficient anesthetic delivery, which was released in November 2018. And some of the highlighted features that the manufacturer has for this device is their control injection flow. So within this device, there's a pressure feedback sensors that ensures consistent delivery of the anesthesia to reduce the pain caused by the anesthesia acidity and the injection pressures during the administrations. And most of the time, anesthetic administration is quite painful for some people because of their acidic natures and the injection pressures. So patient oftentimes they can feel an immediate stings if the full cartridge of local anesthesia is administered too fast. There's also a ramp-up mode, which can help gradually deliver a small amount of anesthesia and allow the tissue to adjust to the pH and reduce the initial stings. And then the injection speeds will gradually ramp up as the tissues gets fully numb. There's also an interligamentory mode where most of the time PDL injections require more force, which can cause patient great discomfort. And so DentaPen can still provide that necessary force for PDL injection, but their pressure feedback sensor will still adjust to the pressures to minimize the discomfort in patients. And lastly, their automatic aspiration is also a built-in features that can prevent accidental injection into the blood vessels by creating a negative pressure in the plunger each time you release the delivery button. And so all of these features can help enhance patient comfort, prioritize patient safety, and minimize dental pain and anxiety, especially for pediatric patients.
The DentaPen has many improved features compared to traditional infiltration that are important to patients and dentists. Solution deposition is commonly the most painful phase of local anesthesia administration. So the DentaPen has a slower flow rate as well as a ramp-up mode, which was mentioned previously, compared to traditional injections. Studies have generally reported moderate to severe pain in the maxillary lateral incisor region specifically, and patients who were administered anesthesia using the DentaPen reported lower pain levels when it was used in this region. Traditional infiltrations reach higher pressures in the tissues quickly because they have a higher initial flow rate, which will lead to pain in patients' gums. Patients receiving traditional infiltrations generally reported a mean pain score of 53 millimeters compared to 33 millimeters for DentaPen. Traditional infiltrations also have variable erratic pressure throughout the entire administration because of difficulties with controlling fluid flow by hand. The ramp-up mode of DentaPen combats this issue by delivering anesthetic at a lower overall pressure initially, and the pressure on the tissue remains constant through the entire procedure, which will lead to lower overall pain. Overall, the pain of solution deposition was significantly lower for DentaPen infiltration for men and women, and overall, 75% of patients who were administered DentaPen anesthesia will generally prefer the DentaPen infiltration over traditional techniques.
Some important factors to know before using this device is that it is compatible with any needle or carpule combination. So you don't need to change any other parts of your local anesthesia routine in your office. The kit is supplied with disposable plastic sleeves to prevent contamination between patients, and many of the parts are autoclavable. The device is battery powered, so you must keep in mind that they must be replaced when necessary. Many clinicians testing out the device noticed that it was quite loud, so it is important to notify the patient that you are using this device beforehand because it may make some noises that they're not used to. Switching out the carpules may take some time because you need to wait for the computerized plunger to retract before being able to exchange the carpules. This has the potential to increase the time for administering local anesthesia for patients.
Okay, so in general,
Sorry. As I already mentioned, the DentaPen has different modes that include slow, medium, fast, and interligamentory modes and ramp-up mode. It is customizable for different patients and procedure needs. It has a rewind button, which is needed to remove the carpules, and it automatically performs the aspirations. And it can be held in two different ways, either by the wings like a typical manual syringe or like a pen for better precision and focus on needle placement.
Okay, so now, compared to traditional syringes, the DentaPen is perceived by patients as like less painful and intimidating. In addition, the DentaPen is also compact and wireless. So you can see on the right here, the wand STA is like the leading competitor. It's made up of three elements, including a foot pedal. So it's just big and bulky. And then components of the DentaPen can be reused and sterilized. So with the wand STA, you have to throw out your parts, buy new ones. It's just a hassle.
All right, so as a summary, would our group recommend this product? We said yes, we would recommend the DentaPen because it significantly reduced pain levels during administration of local anesthesia for patients even in the most painful areas of the mouth, such as the administration of local anesthesia into the hard palate when you're trying to numb like anterior teeth, as well as its ability to reduce pain during PDL injections, which are known to be very painful. Given that the dental anesthesia is normally one of the most feared aspects of coming to the dental office, especially for like dental phobic patients, we believe the reduction in pain that the DentaPen can provide was one of the most significant reasons as to why our group chose to recommend this DentaPen integration into dental offices. The automated aspiration reduced risks for patients, and the ability of the DentaPen to switch between administration modes helps dentists customize the administration speeds based on the patient's needs as well as the site of administration. The DentaPen is compact, it's wireless, and it's easy to use. Its components can be sterilized, making it cost effective compared to other competitors out on the market. Lastly, our group recommended the product because it can be easily integrated into any office as it's compatible with all dental anesthetic carpules and needles.
And that should conclude our presentations. Thank you for staying to the end.